So we're here to provide care for your child. I'll be presenting, and if you have any questions along the way, just feel free to ask. So your son Tom was a previously healthy 15-year-old male, but he had facial puffiness, and along with that puffiness, the whites of his eyes appeared red, right, during the first day. But then subsequently, the redness in his eyes went away, but the puffiness stayed, right? And so one thing that you noted is that the puffiness is worse in the morning and it gets better during the day. And she's noted that in the past that he's had a history of allergic reactions. One being a recent allergic reaction to poison ivy. Another one being that he had a recent bout of hives about 5 days ago.
That one scared me.
and also to note with the history of hives is that he's been having hives for the last 3 years. And so and also 2 weeks ago he had a cold. And with that cold he had a dry cough and a sore throat. Those symptoms lasted about 4 days, right? And so since that time he's been healthy and with normal activity and a normal appetite with regular bowel movements twice a day. So his past medical history, so he actually has also a history of frequent ear infections as a toddler, and he doesn't have them any longer, but I'll add that he also had ear tubes placed in his ears, in both ears, and so in theory that probably could have contributed to ameliorating the history of ear infections as a toddler. He's, as I stated earlier, for the past 3 years he's had a history of hives, and he's also had an episode of wheezing, which was 18 months ago. He was subsequently sent home, and he hasn't had an episode since. He has no allergies. He's not on any medications. His immunizations are up to date. His family history is he has a brother with a history of asthma and a younger sister with a history of eczema. And his mom has Graves' disease. And you also have hypertension. Okay, and so on social history, he lives with his parents and his brothers, his sisters, his dog, his cat, and his turtle. On review of systems, everything's pretty much unremarkable except for the presence of puffy eyes. On physical exam, everything is, again, the vital signs are unremarkable. Temperature is 37, heart rate is 90, respiration is 20, and blood pressure is 120/78. On general exam, he was alert and cooperative upon examination. And essentially everything was unremarkable except for the moderate periorbital edema. And so he also had swelling bilaterally upper and lower extremity on his dorsal surfaces. And so he was alert, he's oriented, he was intact. His cranial nerves 2 through 12 were intact. And his motor strength was slightly diminished, a 4 out of 5. In his labs, so his urinalysis showed a +4 protein with a specific gravity of 1.030, which suggests that there is protein in the urine based on that specific gravity. And so also in his chemistry panel, we found that his total protein in it was low, and also his serum albumin was low. And he had an elevated cholesterol. Okay, so everything else was fine. So the thing about it is that so your son is actually, he has his periorbital edema. When he's urinating not just fluids and waste, but also the proteins that are essential, for normal body balance. And so that's a concern for us. It's also a concern that his albumin is low. and most likely the albumin is low in his serum, which is the main component of your blood as far as volume wise. Is the reason being is that because he's losing the albumin in his urine. And
albumin's a protein?
Yeah, it's a protein, and it's the primary protein that a lot of drugs stick to, a lot of ions stick to, and it's more of like a transporter protein, or where it's very sticky and things bind to it, and it just gets moved along throughout the body, and then things jump off when they're needed, essentially. And so the concern is that there's a couple of concerns. So he presents classically with what we call nephrotic syndrome, but also, and with that, we need to do further tests. We don't know the cause of this nephrotic syndrome. And also there's a concern that is this due to something that just recently happened, like environment that he contracted, or is it due to something that's genetic? Because I noticed that the sister has eczema, which is often can be an autoimmune mediated. So when I say autoimmune, I mean that the immune system is attacking a part of the body to mediate some abnormal finding or abnormal physiology. When I say forget, and so that's one thing. And also the brother has a history of asthma, and you have Graves' disease, and so that's what we're thinking. We have two routes we want to go in investigating this. Is this something that's acute, or is this something that's genetic? And so we're going to take both those routes, and then we're going to try to do our best to find a solution so that we can get little Johnny on his way, and he can live a happy life.